Who is going to perform my hair transplant? Doctor or technician? Part 3. Which technician? So in part 1, I explained to you what it means, for the doctor to be involved in hair transplant or not. On part 2, I talked about the doctor, the hair restoration surgeon, and the concept of which doctor. And now I want to talk about which technician, because since hair restoration surgery is predominantly a technician's job, even if there's a doctor's involved, and frequently there's almost no doctor involved, now we have to understand that we have to ask this question: which technician is going to perform my hair transplant? What are their training backgrounds? Who have trained them? What's their name? Etc. So once we realize this is obviously tied to which doctor, because just like hair restoration surgeons, there is no school that trains hair transplant technicians. There's no official training body that trains them. So they just learn from each other. That means an unknown training source. Or they could learn it from a hair restoration surgeon, but as I explained previously, a hair restoration surgeon is a rare animal that's almost extinct. So which technician becomes an incredibly important question, which almost nobody asks. Now, ideally, a hair transplant technician should be trained by the hair restoration surgeon, who is obviously a real hair restoration surgeon. And wide practice around the world and in Turkey is to use freelance technicians who have unknown training background. So it's mostly an outsourced service. There are clinics that do 20, 30, 50, or even 100 cases per day. Do you think these clinics have 200, 100, or 300 trained technicians? No. They either have none, or they have very few, and the remaining is just outsourced to technicians who have unknown training backgrounds. So that's a very critical topic. So that's why it's important to know who these technicians are. Do they have a license? Who trained them? And so on. Like at AEK Hair Clinic, we only use technicians that I trained. We never use freelance. In fact, we don't even recruit technicians who have previous experience, because I think they're spoiled. They can't be trained properly anymore. So I require them to be fresh and new so they can be trained. But it takes many years for them to get trained. Now, my life would not be long enough to train tens or hundreds of technicians that are really trained. So that's why when you look at clinics that do 30, 50, or 100 cases per day, you have to be sure that most of those technicians have unknown training backgrounds. So I recommend you consider that question. Who are the technicians? Which technicians are going to be involved in my hair transplant?